everyone, myself Dr. Prarthana Debnath, and today's topic is blood collection and anticoagulants. Now, this is a very important topic for your practical purposes and also for competitive exams like NEET, PG and NSA. So, you have to master each and every slides, okay? Now, why we collect blood? Okay, so we collect blood mainly for diagnostic purposes, therapeutic purposes, and also for research purpose, blood transfusion. Then there is something called as therapeutic phlebotomy, which is done in case of polycythemia. So for that also, blood collection is needed. Now, as you can see, the types of blood sample, that is whole blood, plasma and serum. So what is the difference between these two? Whole blood, basically, whole blood is consist of plasma, which is 55%, and formed elements, which is rest of 45%. Now, formed elements are WBC, RBC and platelets. So, what is plasma? Plasma is basically serum with clotting factors. So, this is the whole blood, which is this tube has anticoagulant. Okay? Now this tube is also having anticoagulant. If we centrifuge this tube with anticoagulant, we will get this supernatant, which is plasma. Okay. Now this is the RBC, which is the sediment, and in between these two layers, it is WBC and platelet, which is known as Buffy code. Remember, it is very important point for your Viva. What is Buffy code? And it is consist of WBC and platelet. Okay. Now this is as you can see, serum and blood clot, and which is basically this one doesn't contain any anticoagulant. Now, what are the precautions you will take during blood collection? Use of sterile equipments, obviously it is important. Otherwise, there will be spread of infection. Okay. Now, avoiding prolonged use of tourniquet, this is also essential. So, why it is important? Because if you use tourniquet for prolonged period of time, tourniquet is basically pressure we apply before blood collection or during blood collection. So, if we apply pressure for longer period of time, which is more than 1 minute, there will be hemoconcentration. Alright. So, one very important point to remember is that during calcium estimation of blood, you won't use tourniquet. We don't ask the patient to clench his fist. Okay. So, if you do that, there will be false results. So that's why we avoid prolonged use of tourniquet. Understood? Then mixing anticoagulant tubes gently is also important to get the result accurate, and then leveling sample correctly is also important. Otherwise, there will be misidentification of samples, or avoiding hemolysis is important. If there is hemolysis, there is breakage of blood cells, we won't get the result, right? So that's why avoiding hemolysis is also important. Now, what is the prerequisites? It is patient's identity should be available, a proper requisition form, appropriate test tubes for sample collections are available. So, there are some vacutainers you will be seeing after the class. So, different vacutainer is for different tests, right? So, for example, the green one, the green vacutainer is for ABG, that is arterial blood gas analysis, and another, the purple one is for CBC. So, if we are doing CBC and if we are taking the green one, we won't get the result. So that's why appropriate Vacutainer is also important. For biochemical test, patient should be aware of fasting. So what is fasting? So this is also important. Please write it down. Fasting is 8 to 12 hours of, the time period for fasting is 8 to 12 hours. Alright. Now, correct volume of blood sample should be collected in appropriate Vacutainer, as you already know. Needle. It is important to remember the size of the needle. So for that, I have the interesting mnemonics for you. So you start from 19. So basically, as you can see, this is 16, which is larger in gauze, and this is 23, which is smaller. So you remember that the gauze concept is opposite of the number and the size. Now you start from 19 and you delete one number in between. That is 19, 21, 23 and 25. Okay. Now, as you can see, it is written that for adults it is 19 or 21. So, 19 or 21, it is A, and then for children it is 23. So, C, it is 23, and there is something called butterfly needle, which is basically when blood has to be collected from a very small vein. So, 21, 23 and 25, these are smaller needles, so it is B. So you start from 19, you eliminate one number and write A, B, C, and you are sorted. Understood? Understood the mnemonic? So, method of blood collection, capillary collection or skin puncture technique, and then third one is ABG, that is arterial collection of blood. Okay? Now, so what are the sites of blood collection is also important. For venous blood collection, the important vein is the median cubital vein. You remember the median cubital vein is vein of choice for Venipuncture. It is a very, very important question for Viva. So why median cubital vein is important? Because it is the superficial one. It is also easily accessible and easily visible also. And then it is also supported by aponeurosis. Okay, and it is also connected with a deep vein through perforators. So that's why we use median cubital vein as an ideal vein for blood collection. Other veins are basilic and cephalic vein, which are on the medial side and lateral side of the forearm respectively. Okay, so there is something called as central line, basically done for patients like cancer patients, chronically ill patients, or cancer patients which are on chemotherapy. So for those patients, the veins are already collapsed. You won't get peripheral veins properly. So that's why we do central line. So what are the veins we use for central line? These are the internal jugular vein. Okay. Then subclavian veins. Then femoral veins, and also brachial vein. Now, capillary collection or skin puncture technique. Basically, the most important sites are these three fingers. Okay, these three fingers. That is the second, third, and fourth. You remember that yo sign. This yo sign is avoided. Okay, what does that mean? That means we don't use the tip of the thumb, we don't use the tip of the little finger for the procedure. Why? In anatomy, you have already read that this is the thumb, so this is the radial side, so it contains radial bursa, which is up to the tip of the thumb. Okay. Now, these three fingers contain what? Ulnar bursa. Now, for these three fingers, the ulnar bursa is not up to the tip. But for this little finger, this is up to the tip. So, what we are getting? So, we are getting here, that is on the tip of the thumb, that radial bursa, and here ulnar bursa. That's why if we prick here, so the infection will spread to the palm and then to the forearm. So, that's why these three fingers are only used, that is second, third and fourth finger are used for capillary collection of blood. Now, other sites for infants are the babies more than 1 year old. So this is the heel. So for heel, we don't use the central part. Why? Because the skin is very soft, so there will be chances of injury. So that's why the medial parts or the lateral part of the heel is taken. And then for earlobes, like earlobes is also used in adults, mainly in case of burn patients. Okay, now this is arterial blood collection. So arterial blood collection is mainly medicine topic. Still you have to remember some specific points. So the main site is radial artery. Okay, so and then other arteries are also femoral and brachial artery. So there is something called as modified Allen's test. Okay, so for any arterial procedures, like the main artery here is the radial artery, so you have to know whether the radial artery is working properly or not. So for knowing the patency of the ulnar arches over the pump, you will do modified Allen's test. Just remember the name. Modified Allen's test is done for before any arterial procedure to check the patency of the ulnar arches. Now for ABG, that is arterial blood gas analysis, the syringe which we are using, it is flushed with 0.5 ml of heparin. You remember, this is not the total concentration of total amount of heparin. It is just the syringe is flushed with 0.5 ml of heparin. And as you can see, heparin, so green को हम हिंदी में क्या बोलते हैं? हरा. So that's why the green Vacutainer, it contains heparin. ठीक है? Now you have to know about the details of these three procedures. Venous blood collection is done for most of the cases like the CBC, blood grouping, hormonal assays, liver function or renal assays. This is the capillary collection. This is specifically done for blood sugars, hemoglobin concentration, blood grouping, BTCT or peripheral blood smear. In ABG, arterial blood gas analysis, you just remember it is only done for arterial blood gas analysis. Okay? Now you have to know the details. So how we are doing venous blood collection? So first of all, you will fill the requisition form. So in the requisition form, the name of the patient, the ID, date, it is written over, and then you will confirm the identity of the patient. So then you will explain the procedure to the patient and will take consent. Alright, then you will assemble all the equipments which are needed. You can see it is kept over here. Then you will wash your hand properly for 2 minutes, maintaining appropriate sterility. After that, you will wear gloves. Okay, now after that, you will apply tourniquet. Remember, tourniquet is applied for 1 minute. It is not applied for more than 1 minute.
In detail, all these things. Okay.
Just 2 to 3 fingers above the site of collection of blood. Okay. Now, after applying tourniquet, you will ask the patient to clench his fist. Alright, why clenching of fist and applying tourniquet is important? It is important to visualize the vein more prominently. Okay, now after that you will tap over the vein or you can palpate the vein to know the exact location of the vein. Now you will do proper antiseptic management of that site. How? So you will take a cotton swab. You will take 70% alcohol. So with 70% alcohol, which is commonly known as spirit, as it is also kept here. So you will wipe the area. How? It is wiped from inside to outside, not from outside to inside. Remember, outside to inside is avoided. Why? Because from outside we can introduce infection to the site of collection, right? So we don't want that. So that's why we always clean the area from inside to outside. So after cleaning, we will use the syringe. Remember, the syringe which contains needle. So it is like that. So this is the beveled end. This is the beveled end. This will. Okay. So this is the beveled end. Beveled end is always kept up. So ये ऊपर रहेगा, ठीक है? Now this needle, I mean the syringe. You will introduce the syringe maintaining a angle of 15 to 30 degree. Now you will draw blood and you will notice a little drop of blood between the needle and the syringe. As when we will notice the blood which is between needle and syringe, it is coming. Now you will ask the patient to open his cleanse and you will remove the tourniquet. After that, you will draw blood slowly and then you will apply pressure on the side and slowly you will release the needle. Understood? And then you will apply an adhesive at that side and you will put the blood which is collected over a specific Vacutainer. So we have a video discussion on that also. After that it will be very clear. So up to this much, is it okay? Okay. Now this is capillary collection of blood. So up to wearing gloves, everything is same. So after wearing gloves again, you will hold that side and you will clean the area. Which 3 fingers? These 3 fingers. Second, third and fourth. Okay. So after cleaning that side, you will introduce the needle or lancet and you will discard the first drop. So why first drop is discarded? Because it contains tissue fluid and also it is contaminated. Now you will squeeze. You will not squeeze. I mean you will apply a little pressure, not too much pressure for blood. Then you can use microtubes for collection of blood and then you will use a cotton swab for cleaning the area. Now after that, whichever equipments we will be using, we will discard these equipments maintaining appropriate biomedical waste management method, which we will discuss. Now these are the scenarios in which the specimen is rejected, that is clotted specimen, severely hemolyzed specimen, if the specimen is improperly labeled, if the specimen is too old or failure to meet the volume criteria, improperly labeled or diluted capillary specimen, if there is leaking of the tube or delayed in transport or collections of specimen in wrong tube. Okay? This is very important slide where maximum questions will be asked. So, local complications. Complications are mainly of 2 types, local and systemic. So, these are the local complications. Hematoma. See, these are very common. So, as a physician, you should identify what is hematoma, what is bruising. Now, hematoma is collection of blood. Bruising is also collection of blood, but it is on the subcutaneous plane. Hematoma is not necessarily on the subcutaneous plane, but bruising is collection of blood on the subcutaneous plane, and in hematoma you will notice swelling. A pain will be there, as you already know. Infection, phlebitis. So what is phlebitis? Phlebitis is inflammation of vein. Remember, it is not infection. Infections and inflammations are 2 different things. So this is inflammation of vein and then nerve injuries could be there. Then systemic complications. So syncope, which is in layman term, we call it as fainting. Then hyperventilation, it is mainly due to anxiety. So there is something called as convulsion. So what is convulsion? Convulsion is uncontrolled repetitive shaking of the body due to contractions or relaxation of muscles, which may or may not be associated with loss of consciousness. It is mainly due to CNS problem. Okay, and then there could be hemolysis or excessive blood loss, then needlestick injury. This is also very important to remember that needlestick injury is is a cause of hepatitis B, C and HIV infection. So examiner will ask, what are the infections which are spread through needlestick injury? This is hepatitis B, C and HIV, and also syncope is important. So this is bruising and this is hematoma. As you can see, in hematoma there is swelling around the knee. So after hematoma or swelling or phlebitis, you will use these medicine. The brand name is thrombophob gel, which contains heparin gel. So what is the mechanism of action of them? Which inactivate the clotting factor 2A and 10A. So if heparin is enhancing the activity of antithrombin 3, there won't be any clotting, right? So it is preventing the clotting factors. And locally heparin gel, it improves, it prevents more clotting and improves blood flow, reduces swelling and helps bruise or hematoma to heal faster. You just remember the term heparin jelly, the activity is antithrombin 3 to enhance the activity of antithrombin 3 and you are sorted. So syncope, so in layman term, as I said, it is fainting. So what is that? It is sudden loss of consciousness due to reduced blood flow to the brain. Now, what is the concept here? So for syncope, there are so many reasons. The most important reason is vasovagal syncope. बोलते हैं ना हम खून देख के चक्कर आके गिर गया, तो क्यों हो रहा है ये सब? So it is happening mainly due to parasympathetic system, activation of parasympathetic system. So as you know, parasympathetic system, it is having vagus nerve. So what vagus nerve will do? It prevents the heart. So heart will not pump. So if the heart doesn't pump, it will not allow blood to go to the brain. So there will be transient loss of consciousness. So what are the symptoms? The symptoms are dizziness, blurred vision, sweating, pale skin, weakness or brief episode of fainting, as I discussed. So what is the next step? So you remember, in case of any complication, the next step will be always immediately stop the procedure. Immediately stopping of the procedure is the next step. So in syncope also you will stop the procedure immediately. You will check the vitals of the patients like the BP and pulse, and you will keep the patient in proper position. So what is proper position? This is proper position, that is elevating the patient's leg above the head level to restore blood supply. Basically, this position helps to restore the blood supply by improving the venous return. So if venous return increase, there will be increase of cardiac output. So that's why the oxygenation to the brain, it also improves. So biomedical waste management again is very important. So this is basically a PSM topic. So here I am discussing biomedical waste management for only blood collection purpose. So I will be giving you certain mnemonics. Okay. So in yellow, for yellow, the mnemonics is, it is starting from A. So A say is animal waste, you can write it down. A is animal waste, B say body, this is animal waste, B say body means human body waste, alright. C, you do some cheating here and make it S, which is soil. This is the takeaway from this slide, that is C is soil. That means anything which is soil with anything, soil with blood, soil with pus or soil with sputum, it will go to that yellow bucket. D for discarded medicine or expired medicine. E for, you have to cheat here and write it C, means chemical. F say fluid. So what are the fluid? These are urine, blood, sputum, etc. G say it is not gloves. Remember, it is not gloves, it is gown, nylons, these things. So this is for yellow. Now for red, For red, you remember RTP. That is, anything which is made up of rubber, tube or plastic will go to red. Now, gloves. Irrespective of whether they are soiled or not, always gloves will go to red category. ठीक है? Now, white. White category is for sharps. You can see here, white category is for sharp, and then blue is for glass. So, another important point to note that Vacutainers when they are full with blood, when Vacutainers are blood, that means they are soil. So, soil को हम क्या कहाँ रखते हैं? Yellow में जाएगा, ठीक है? So, when Vacutainer is empty, that means it is what? That means it is plastic. So तब कहाँ जाएगा ये? Red में जाएगा. Okay. Now syringe and needle कहाँ जाएगा? Syringe is what? Syringe is syringe and needle are different thing. Syringe is that plastic part. So plastic part कहाँ जाएगा? Red में जाएगा. Rubber tube and plastic, and needle जो होता है, which is sharp. So sharp white में जाएगा. So ये देख लो. And any general waste जाएगा black category में. यहाँ पे देखो yellow soil, you remember yellow, you remember soil. Red is rubber tube and plastic. Black is all the general waste. Blue is glass, and then white is sharp. So there is something called as cross mnemonics. So it is for bags. यूरिन का कलर क्या होता है? येलो. तो यूरिन बैग जाएगा रेड कैटेगरी में, ठीक है? नाउ ब्लड का कलर क्या होता है? तो ब्लड बैग जाएगा येलो कैटेगरी में, ठीक है? सो यू रिमेंबर दिस वन, यू रिमेंबर RTP, वाइट एंड ब्लू, एंड दिस क्रॉस mnemonic, ठीक है? Now, this is a very important slide. You have to master each and every word written over here. So, the most commonly used one is the lavender or purple color, which contains EDTA. So, it is used for maximum hematological studies like the CBC, ESR, hemoglobin, TLC, DLC, platelet count. Now, this one, blue one, which contains sodium citrate, the uses are coagulation studies like PT, APTT, D-dimer, FDP, etc., and also used for ESR. So as you can see, this is also used for ESR and this is also used for ESR. So how to remember that? So you remember lavender color contains EDTA, which is ethylene diamine tetraacetic acid. So EDTA contains E. So whenever we are doing ESR, which in Winthrop's method, Winthrop's contain what? E at the end. So it is also contain EDTA at the beginning. So that's why this one, the lavender one, we will be using for ESR estimations in Winthrop's tube. And this one, blue one, as it contains sodium citrate, so it will be used for wasted green method. Okay. Now this grey. So grey is also very important. It contains sodium fluoride and potassium oxalate. So this sodium fluoride is not an anticoagulant. You remember the anticoagulant is potassium oxalate. So why we are adding sodium fluoride is to prevent the enolase enzyme. So enolase is an enzyme of glycolysis pathway. So what will happen? So if we are using sodium fluoride will prevent the enolase enzyme. So there won't be any glycolysis. So that's why we are using that grey vial is for blood glucose estimation and also for lactate or alcohol estimation. Alright, is that clear? Now these blue, these lavender and this grey, all are having these three anticoagulants. So the mechanism of action is chelation of calcium. So everyone, the mechanism of action is chelation of calcium. And another point to remember that this red one and golden one doesn't contain any anticoagulant. So what is the difference? Only difference is that in red there is no additive or clot activator is added, but in golden clot activator is added. So that's why, as there is no additive or clot activator, it allows blood to clot naturally, and here in the golden, as clot activator and cell separator is added, clot will be formed. So for both the cases, these two we are using for serum studies. Okay, so red one for serum biochemistry, immunology and serology. The golden one serum test like the hormones and hormones, electrolytes and enzyme. Okay, so you remember these things, mechanism of action and uses. Is it clear? So these are the vacuolators. This one, the lavender one, most important one, contains what? EDTA. This one. And these two doesn't contain any anticoagulants. Is that clear? So this is order of blood draw. You have to master this slide also. So for this slide, I have got mnemonics for you. Okay. So you just imagine this diagram, and you are sorted with everything. Okay, so one day you are sitting under the sky to enjoy the view. So the sky, which is blue color, and you can see sunrise also, the sun, which is red color, and you can see some trees also here. Okay, now below this you can also see lavender color flower garden, which is on a soil which is grey color. Okay, so what you have to remember? You just remember the first one, the order of draw, the first one is for blood culture, which is yellow. You just have to remember this thing, the first one is blood culture and yellow, and you remember this sequence. Okay, so blue sky signifies what? Blue Vacutainer. The red sun, it signifies what? Red Vacutaners. The tree signifies green Vacutainer, and this is the flower garden, which signifies lavender Vacutainer, and this is the soil which is grey color, which signifies grey Vacutainer. Is it clear? Is the diagram or the mnemonics clear? You can take photos also. Sky color, I mean the sky blue color sky, then or red color sun, and then this one green color tree and lavender flowers and soil, which is grey color. So again the same thing, blood culture tube, yellow, then blue, then red, then green lavender and grey Vacutainer. This is the order of blood draw. In this order you will draw blood for Vacutaners. Okay? So is it clear? Okay. So thank you so much.